Hello everyone, my name is Dr. Patrice, a specialist obstetrician and gynecologist. I'm currently pursuing my master's in global public health, and today we are diving into one of the most pressing health challenges of our time, HIV prevention. As a medical doctor, I have seen firsthand the impact of HIV on communities across the globe. In today's episode, we have with us a teacher, an advocate, a researcher to talk to us about HIV prevention in Africa. He is Dr. Fernando Ngoji.
Thank you, Patrice, and thank you for having me on the show. Let's do it the African way. You have to shake, like where we come from, we really have to shake.
Yeah, thanks for making time to join me today, Dr. Fernando.
You're welcome, thank you. Yeah.
So, Dr. Fernando, can you briefly introduce yourself to the audience?
Yeah, as Patrice has said, my name is Dr. Fernando Ngoji. I'm a Kenyan medical anthropologist I'm currently working here in the Republic of Ireland, in this part of Europe. Mostly my work revolves around, how people adapt to new technologies and how the users can actually co-create to come up with systems that work for them. But I'm specifically focusing on HIV prevention technologies, and mostly at the last mile. Like when you look at the supply chain of HIV medication and also the services, there's this last mile, which is normally the most critical part of access. So that's where my focus is. Apart from being a researcher, you already talked about it, I'm an activist, I'm an advocate, I'm a person who believes that, when interventions are out there, they should actually get to the people and really help the people. You see, if there's a medicine that cannot be accessed by the people, then that's not the right thing. So that's what I do. Like, that's me, that's my life. Yeah.
And have you been involved with any work in Africa, especially Kenya, in HIV prevention?
I was born in Kenya, and my history with HIV in Kenya is quite personal. Like, I come from this region in Kenya, which is has one of the highest prevalence of HIV. It's just at the border of Kenya and Uganda. It's a county called Busia in Western Kenya. So then I lived, growing up as a child in Kenya. I only moved to Ireland 5 years ago. So then most of my work within HIV has been in Kenya. And even here in Ireland, while doing my research in Ireland, I am actually just based here physically. But 80% of my work is actually implemented and is actually done in Kenya. So, growing up seeing, your neighbors dying, your relatives dying out of something that is actually preventable and something that can actually be, there's medication actually to help them to live a longer life. For me, I really felt bad when I learned that actually these interventions do exist, and I made it my personal initiative to contribute through research and advocacy, first of all, to my community, which is the community in Western Kenya, where I've done most of my research, and the country as well, and the entire continent of Sub-Saharan Africa, and extend to the world. So that is my contribution in this, and my relationship with HIV and HIV prevention research in Kenya. Yeah.
So you've told us the reason why you got interested in HIV. Why didn't you consider malaria but HIV?
I think, just as I've said, I grew up looking at HIV as this killer disease. And the reason why, for me, HIV was the killer disease, it's because of the myths and misconceptions that I grew up hearing. People, they were calling it the big disease. So you say, oh, you have the big disease, you have the killer disease. If you have HIV, you'll die and all that. So then when I went to uni, and I met a researcher, I was doing his postdoc in London, and he introduced me into the HIV world now as a researcher. And I realized that, oh my God, there's just so much intervention that could be done, both biomedical and behavioral intervention that could actually be done to reduce HIV. There's a lot that has been done in malaria. I can tell you, there are drugs there's mosquito nets. Like when you go to Kenya, like where I come from, also it's a very area with high prevalence of malaria, also because we live close to the lake, like Lake Victoria. the biggest lake, the biggest lake in Africa, and the second biggest freshwater lake in the world. So there's a lot of mosquitoes and all that. Like, we grew up sleeping in mosquito nets, so that was not like a very big deal for us. But we thought that HIV did not have any intervention. And then for me to discover that there's a lot of research taking place in this area, I said I must be part of this. And that is how I got myself motivated and interested in the world of HIV. Mostly prevention.
So when we talk of HIV, what is HIV and what's the difference between HIV and AIDS? Because a lot of people get confused about the difference between these two and they use them interchangeably.
Yeah, so basically when you get infected with the virus, that is what we call, like, now you have been infected with HIV first. So that is the first stage. So then over time, after a very long time of especially not undergoing treatment and all that, so the very advanced stage, which is like the very last stage of the virus, that is what now we call AIDS, of which not everybody will actually get to AIDS. Because you see, nowadays we have technology that you can be treated, the antiretrovirals, they are very, effective antiretrovirals. So they suppress your viral load to the point that even it's undetectable. So then most people get to live a very long life because they don't get to that stage of AIDS. So from a layman, because I'm trying to put it like most people will be listening to this and watching this, actually lay people. That is the difference, because this is how HIV gets in your body. Like, the moment you're infected with the virus, it targets what we call in your body, we call them the fighters, the soldiers in your body, what they call CD4 cells. So it starts harming your soldiers. Then when the soldiers in the bodies are harmed, the numbers reduce, then your immunity reduces. Then you are vulnerable to what they call opportunistic infections. The other diseases that, when you get malaria or you get a flu, it can put you down so quickly because you don't have enough CD4 cells, what now you'll be calling the soldiers in your body. But now you see, if you ignore treatment and you don't start ARVs, that's why you see most countries have policies of, like in Kenya, we call Anza Sasa, meaning start now. The moment you're tested and you're found to be HIV positive, you are supposed to be put on treatment immediately so that we avoid the rapid replication of the virus that will make you to get to now that stage of AIDS over a long time of not having any treatment. Yes, there are some people who actually take treatment, yes, but they don't adhere to the treatment. Because treatment works only when you take it. Just like a condom. A condom prevents you from HIV or from pregnancy when you put it on. So if you take medication from the hospital, from the clinics, and you don't adhere to them, then you won't be prevented. I mean, the viral load will not go down, and you are likely to get the advanced stage, what we call now AIDS. Yeah.
So, to our viewers, CD4 cells are basically white blood cells that define our immune system. And so what you're saying is that AIDS is the most advanced form of HIV. It's like soldiers putting down their guns and not being able to.
They have given up now. Yeah, the way even during the World War, there's some countries that gave up and said we have surrendered. So when it reaches, the body reaches, because I'm trying to break this to a layman's perspective. When the body gets to the point that now we have given up, we cannot fight this anymore, then that's it. Yeah, that's the point now, we call it AIDS. Yeah.
And at the advanced stages, that is people with AIDS, they are also prone to a lot of cancers. Do you know any of them?
I wouldn't comment about that, but because now I'm not into medicine, I'm mostly into the social aspect of disease. Yeah. But when you have HIV, literally your immunity is is low, you know, you take ARVs to increase your to actually suppress the virus, you know. So then when the immunity is low, then it means you are exposed to all sorts of things, you know, and it's so easy for you. That's why it's so easy for you to get sick, to get any type of disease. It's so simple for you to go down. So most people who have been infected with HIV, I look at it more from an STI perspective. They are likely also to have other STIs, because, you know, most of the time HIV is transmitted through sexual intercourse, and that is unprotected sexual intercourse. And most other STIs are transmitted through the same. So then there are other viruses that are also, that might cause sorts of other cancers, like you see the HPV, that is transmitted also sexually, you know. Yeah. So then you see HPV, then people with HIV, there's a very high chance that some of them might be vulnerable to HPV that causes cervical cancer. You see? So that is the link. So that is how now the thing just goes around and around. Yeah.
So in addition to the cervical cancer, AIDS patients are also prone to lymphoma and Kaposi's sarcoma. The fight against HIV in Africa remains critical, but with continued efforts in education, access to healthcare, and community-driven initiatives, significant progress can be made. Empowering individuals with knowledge, expanding testing and treatment, and reducing stigma are key to preventing new infections and improving the lives of those affected. Together, we can work towards HIV-free generation in Africa. Thank you for joining us in this important